Welcome to Pain Care Specialist of Oregon, Facebook Live and YouTube Live interview with Dr. Cuong Vu.
Hi, everybody. So today I'm going to talk about low back pain and just some of the basic causes of low back pain and how your body actually works against you and prevents you from getting better when you do have pain. So we're going to start with the slideshow. Okay. Now, the things that I'm going to talk about, I'm going to talk a little bit about the anatomy of the spine. So basically what the back actually looks like. And this is important because what you'll see is that there are a lot of little structures in the back, and all of these can potentially cause pain. And that's one of the big reasons why low back pain is such a huge problem and oftentimes can be difficult to treat. I'm going to talk a little bit about the different causes of back pain and talk about how we compensate when we do have pain that oftentimes works against us and makes it so that our pain doesn't necessarily get better, but sometimes actually gets worse. And then lastly, we're going to talk about the different treatment options for low back pain. So when we talk about the low back, we really are talking about the lumbar spine. And that is the lowest part of the spine. And it's very complicated with lots of different moving parts. In the next slide, I'll show you different pictures of all the little joints and all the little bones that kind of make up the low back. And just to show you what a complicated structure it is, and all these pieces are moving together, which oftentimes makes it difficult for us and for people to kind of tease out what is actually causing the pain. So here's a picture of the lumbar spine and also the pelvis. And as you can see, there are a lot of little bones that make up the spine, and all these bones move on top of each other. And this allows you to make complicated movements with your back. It allows you to twist, it allows you to bend. And if you could imagine, we oftentimes hear about arthritis of the knee and other joints, but there are lots of little joints in the low back, and all of these little joints can potentially cause pain. Also, the spine contains not just joints, but also nerves. And these nerves themselves can also cause pain. It's typically when somebody has nerve pain, they call it, quote, sciatica. And even though it starts in the low back, oftentimes people feel this down their legs. And so not only do we have a lot of little bones, a lot of little joints, but we also have a lot of little nerves that are in the spine, which is another reason why the back is complicated and can potentially have lots of different areas that can potentially cause pain. Along with the bones and the nerves, we also have muscles. Now, if you look at this picture, there are a lot of little muscles that kind of attach to the spine that allow us to do these complicated movements. The muscles themselves can also be painful. So when we talk about causes of low back pain, we try to differentiate the causes as pain that remains in your back and pain that travels somewhere, or what we call axial or radicular. So pain that remains in the back, we think of more of kind of musculoskeletal. We think of the joints, the bones, sometimes the discs, the different ligaments that hold the bones together. These are the things that we think about when we think about pain that actually remains in the back. When we think about pain that travels somewhere, meaning pain that maybe shoots down your leg or wraps around your abdomen, we think a little bit more about the nerves, because even though the nerves start in your back, they go to other structures. The nerves in the low back actually go down to the legs. And so when you do have irritation or you do have nerve pain, you actually may feel it more in your legs or in other areas, even though it actually is coming from your back. So when we think about one of the big causes of pain that remains in the back, we think of kind of musculoskeletal pain. So pain that comes from either the muscles. So often, a lot of us have had knots at one point or time in the back, an area that you kind of press and you're like, that really hurts. And those are what we call trigger points. So the muscles themselves can be painful. People can have arthritis of the spine. Now, arthritis is basically inflammation of a joint. So just like the example I used before, you can have arthritis of the knee. You can also have arthritis of the tiny little joints in your back, and that's what we call facet arthropathy. Okay. Now, the lowest part of your back is actually a different joint. It's what we call the SI joint, where so here's a just to go back a little bit. Here's a picture of kind of what muscular pain may look like, and what are some of the trigger points. Right here is a picture of the joints in the back, and you can see here that these joints themselves can become arthritic. And going back to the SI joint. So this is a picture of the SI joint. So it's the largest joint in the body. It's where your hip bones here, the iliac crest, actually connect to your tailbone. Okay. And so when people have pain here, it's a part of the back. So they feel that it's in the low part of their back. And as you can see from this picture, there are lots of structures just in this area as well that can potentially be painful. There are a lot of ligaments that span the area. There's the actual joint, which you can see on the left here, this line right here where the arrows are pointing to, and that joint can get arthritic. The ligaments themselves can get strained, can get a little inflamed. And so that's another kind of cause of low back pain. Now, one thing that we commonly hear in the clinic, and just you even hear it on TV, is I have degenerative disc disease. And what that really means is that in between your vertebrae, or in between these bones here, there are these little cushions, and those are the discs. When those discs start losing their fluid, they can become degenerative. Okay. Now, degenerative disc disease can cause pain, but typically this is a process that happens over time, and it doesn't necessarily mean that somebody is having pain actually from the discs. What oftentimes happens is, if you can imagine that these discs are spacers. And so when you have these discs that kind of shrink, that kind of get smaller, you get a little bit a misalignment of the joints. And that may make someone more prone to developing arthritis, because the structure of the back itself is not symmetrical. There's uneven wear and tear on the different joints just because this disc itself has degenerated. Now, it's very common that as we get older, that our discs do lose some of its fluid. And this is the reason why when we get older, we actually shrink when we get older, is because you can imagine that since these discs are spacers, they actually provide some of our height. And over time, as they lose fluid, you actually shrink in height. One thing that you can do, an experiment at home, is you can measure yourself in the morning, and you can measure yourself at night in terms of how tall you are. And what you'll see is that at night, you're actually shorter than you are in the morning. And that happens that as you walk around, your body's pressure is kind of pressing on these discs. And slowly over time, over the day, they lose a little bit of fluid. But when you go to sleep, that disc re-expands, and so you're actually taller in the morning. So if you want to feel tall, just measure yourself in the morning. Now, another cause of back pain, we talk about the complicated structures in the back, the different joints, the muscles, but the bones themselves can potentially cause you pain. You can have a fracture of a bone. Less common, but it can happen, is that there can be a tumor in the bone. But the actual what we call the vertebral body, which is this block of bone in between the discs, can also cause some pain. Now, moving to radicular pain, or pain that kind of travels to another area, we think a little bit more about nerve pain. We commonly hear this idea of a herniated disc, and someone says, "Oh, I have a bulging disc," and bulging discs are extremely common. And it's not necessarily the disc that causes people pain, but the pressure that the disc actually have on the nerves. And so when someone does have a herniated disc, they oftentimes have what people call sciatica, which is basically pain that kind of travels down the leg. Other common causes of this kind of nerve pain, you can have narrowing in the back, and that narrowing could be a combination of arthritis, where when you have an arthritic joint, the example I like to use is just like your hands. If your hands get arthritic, we commonly see this, that the joints actually get bigger. Now, just imagine that in the spine. If your joints in your spine get bigger, something else actually has to get smaller. And what gets smaller is the space for the nerves. And so what ends up happening is those nerves, they kind of start rubbing up against that narrowing, and it triggers this nerve pain. And so one example is, just imagine that your spine is like a pipe that contains wires. Now, if that pipe is narrow, the wires will start rubbing up against the narrowing. And those wires oftentimes go down to your legs. And so those wires kind of move back and forth as you're walking, as you're moving your legs, just from your legs tugging at those nerves. And that's why sometimes people who have narrowing in their back, they actually don't really start having pain until they start walking. Because if you just imagine that pipe again, and those wires, you just keep walking, those wires are tugging and tugging and tugging. They rub up against that narrowing, and that's kind of what triggers the pain. Mm-hmm. So here's a picture of a herniated disc. As you can see, as the nerve comes out of the hole, the disc itself may start rubbing up against the nerve. Here's that spinal stenosis, which is that narrow pipe that we talked about. And you can just imagine that if these nerves here were moving back and forth, it would be rubbing up against these bones, rubbing up against these discs, and that's kind of how it kind of triggers pain. Now you can also have kind of a misalignment of the bone, and that itself can cause this kind of spinal stenosis type of picture. We're also starting to recognize that there are other kind of smaller nerves that may actually start contributing to back pain. There are these cluneal nerves, which kind of go across the back, they go across your hip, and just like the nerves in the spine, they can actually be irritated. They can actually be irritated by the muscles that kind of are located in the back. And so that's one of the things that we're finding to be another cause of back pain. Now, when you have back pain, the problem is when you have pain in general, evolutionary wise, we think of pain as something that's wrong, something that is dangerous for our body. You're running away from a tiger and you have an injury, the pain means that something's broken. And so we learn very young that if the stove is hot, don't touch it, right? And so in our minds, what we think of is, if something hurts, that means I'm doing serious damage to my body. And so we try to avoid doing these things, and we change the way that we walk, we change the way that we move. And what that actually causes is it causes us to start developing other areas of pain. Now, one of the things that is a good example of this, like let's say that I put a rock in your shoe. Now, the first thing that would hurt is your foot, right? And eventually you'll stop trying to put pressure on that foot. And maybe you'll start putting more pressure on your other foot. And over time, what's going to happen is that your other side is going to start breaking down. It's going to be your knees, and then your hip, and then your back, because you're favoring one side. You're no longer symmetrical. Your biomechanics are all off. And now you have a lot of other areas that become painful. And just because we avoid using something because it hurts, we start causing other areas to kind of break down. And one of the biggest examples of all of this is when you have a herniated disc. Now, if they can put me on the screen here, I will show you. So now if we look at the actual spine itself here, okay, and what we see is there are little holes where the nerves come out, okay. Now what happens here is we have this little disc, and if this disc was going backwards, it would start irritating this nerve, okay, and so it will start causing pain. And what we end up doing is we end up kind of slouching. We end up leaning forward. And when we do that, what ends up happening is, as you can see, it starts opening up the space for this nerve. If you look at this hole right here, it kind of gets bigger as we kind of slouch, okay? Now, as I do that, you can see in this portion of the spine here that as I start slouching, I put pressure on the front part of this disc. And what happens is this actually causes the disc to go backwards even further. And what that does is it presses on this nerve even more. Because we are trying to alleviate pain by opening up this hole right here, by slouching, by leaning forward, we end up worsening our disc herniation because we're putting pressure in the wrong spot of the disc. Now, if I try to sit straight up, which is this direction right here, you can just see that that hole where the nerve is coming out actually gets smaller. And so that may actually trigger more pain. But what that does is it puts pressure in the proper spot on the disc, and it allows that disc to kind of suck itself back in, and it allows your body to heal itself. And so that's the problem with having this severe pain, is it's very hard for us to actually get into the position that will allow our body to heal itself. We move, we shift, we do things that tries to alleviate that nerve pain. But what that does is it makes that herniated disc not get much better because you're putting pressure on that disc that keeps it from herniating. And so when we go into treatments, and a lot of the stuff that we do is really trying to make people feel better so that they consciously and subconsciously are able to get more upright, do physical therapy, strengthen their muscles, actually move normally so that we don't kind of perpetuate the pain, so that we actually allow our bodies to heal itself. And I think that one of the most common things that patients come and say is like, oh, doc, you're going to do this, but it's just putting a Band-Aid on the problem. And in reality, the best way that people can get better is if they allow their body to heal themselves and not undergo something like big invasive surgeries, because not that doesn't have a role, because that definitely has a role in some cases, but if we can avoid it, avoid making fundamental changes to your body. So if we can allow the body to heal itself, that's really the better way to go. And how we allow that is trying to help take care of that severe pain that's causing you to move in directions that you're not supposed to move, causing you to slouch just to get the nerve pain better, causing you to do these things that are really preventing your body from healing itself. And so a lot of the stuff that we do is kind of minimally invasive stuff that doesn't make big changes to your body to really try to get you to feel better so that you can do those other things that will make your body heal itself, or make you feel better permanently by kind of curing the problem by yourself, instead of having something else or somebody else try to quote cure the problem. And some of the things that we can do, some of the treatments that's done, we talked a little bit about nerve pain. Now, if you have irritation to that nerve, or that sciatica that we talked about, you could inject a little bit of steroids around the nerve. That whole analogy I used about the narrow pipe and the rubbing up of the nerve against the pipe. Now, just think of the steroids as kind of like a lotion that reduces that irritation, kind of helps it kind of move around. And that's one of the ways that we can make the nerve pain a little bit better. Now, we talked a little bit about the arthritis pain in the back, the little joints in the back that can potentially be painful. Now, arthritis itself is not dangerous. It's something that obviously causes a lot of people suffering, changes the way that you move, affects your function. But arthritis itself is not something that is like cancer or something else that can potentially kill you. And so really what we try to do is get those joints that are painful to basically stop being painful. And the way that we do that is we can actually ablate the nerves that go to the joint, and that gets the joint actually numb, so that so you don't feel that pain in that joint. So that joint can move around without having a lot of pain. There's other things that we can do. There's steroid injections in the joints. You can stimulate nerves that are being irritated. That's another potential treatment. There's lots of different treatment options, but the whole goal is to alleviate the pain so that we can have some functional restoration, so that we can be a little bit more symmetrical, have our biomechanics a little bit more proper, so that your body can potentially heal itself. Okay, so in conclusion to my talk, pain itself can cause a snowball effect. When one thing hurts, other things can start hurting. And that's oftentimes because of how we adapt to when something is painful. And we consciously or even subconsciously, we change the way that we move just to avoid pain. And it's really important for you to do something to actually break that cycle. Because what ends up happening if you get stuck in that cycle is that other things becomes severely painful, and then it's really hard to break that cycle when other things kind of start breaking down. Now, pain management, the stuff that we do at pain care specialists, can treat the different causes of pain without making substantial changes to your body, and enable you to kind of break that cycle. And that's really what it's about, is trying to break that cycle and trying to get people to move a little bit more normally to help prevent further kind of functional decline. And so that concludes my talk, and I'll just open it up for some questions.
That was excellent, Dr. Vu. Thank you so much, Dr. Vu. We also have Dr. O, who performed the Facebook Live interview last week, and we're here now to take some questions from the audience after watching this very, very informative talk. One very interesting question we have from a viewer is, what are the common causes of low back pain for younger people, since they oftentimes don't have disc disease or arthritis? What would you say, Dr. Vu?
So I think that the most common causes of all back pain in general is really musculoskeletal pain. So we talked about the trigger points. We talked about just these muscular knots. Now, young people may not actually have, quote, arthritis, like what you potentially think about in terms of arthritis, where there's actual just over time degeneration of a joint, but they can have kind of acute inflammation of joints. That's when you twist suddenly in a certain way. One common thing is actually whiplash injuries from car accidents, where you can actually get this acute inflammation of the joints in your neck. And hernia discs are also pretty common in young people. But the most common causes would probably be the musculoskeletal pain, so the muscles and some of the joints and ligaments.
And tell me, what do you think about CBD, acupuncture, chiropractic therapy? That's an interesting topic. These complementary medicine, these therapies.
When we think of pain therapies, I think the most important thing is you got to weigh the risks with the benefits, and so if you take CBD for an example, if you have pure CBD, the risks are pretty low, and it's helped some people. So I would say, if it's something that you're interested in, as long as it doesn't have any THC, if it helps you, then that's great, because it has helped some people. When we look at things like acupuncture and chiropractic work, and we look at the evidence for that, they did some studies on acupuncture, and they found that acupuncture was better than no acupuncture. But when you do acupuncture in the kind of traditional sites versus acupuncture in just randomly placing needles, that they found no difference. And so the conclusions for all these things is acupuncture is better than no acupuncture, but maybe no different than what they call sham acupuncture. But at the same time, the risk to acupuncture is extremely, extremely, extremely low. And I know a number of people that have had a lot of benefit from acupuncture. So I think that, as long as you either your insurance pays for it or you're able to afford it, I think that the risks are pretty low. And if it's something that you're interested in, and you go in there with an open mind, it can actually really help, because it has helped a lot of people. With chiropractic work, there's a lot of people do really well with chiropractic work, and I think that the risks are also pretty low. There's not a ton of data in terms of the long-term effects of it, in terms of oftentimes people feel a lot better, but they may not necessarily feel better in the long run. But again, I think that it can be potential, have a lot of benefit for some people.
We're going to circle back a little bit to what Dr. Andrew O talked about last week about the lifestyle modifications, the wellness therapies. With your new information that you've discussed today, this very detailed talk about low back pain specifically, what is your recommendation, Dr. Vu, about lifestyle changes or wellness types of things that would help low back pain?
So I think that our body is a complicated a structure that with a lot of interworking parts, and I think that in terms of our nutrition, in terms of exercise, in terms of all these things, all that has effect on low back pain. We know that weight itself has a lot of effect on the different joints. There's a reason why the low back is such a common area of pain, and that's because it holds a lot of the weight of the body. It's not the middle of the back. It's actually the low back, because the low back just holds all that weight. And so diet, nutrition, all those things have an effect. And I think that the things that we eat, oftentimes have a big effect on how we feel, how much energy we have, and that's also important in pain.
What about people with pain in the morning, and some people say it's worse at night? What would you say to that?
So it's common that people experience pain differently, whether it's the change in weather. We hear that a lot. When it's cold, my joints kind of hurt, but also in the time of day. Now in the morning, that's when we've been sleeping, hopefully for greater than 8 hours, and our bodies haven't been moving during that time period. And so our joints are a little bit stiff, our muscles haven't been moving. And so sometimes people have a little bit more joint pain, have a little bit more stiffness in the muscle. Now, if that's a really, really severe and you're having it in multiple different joints, that could be a sign of an inflammatory arthritis. And that's something that you probably should get checked out if it's really severe stiffness in the morning. Now at nighttime is when we're trying to go to sleep and we're calming our bodies down. And so people who typically have a lot of nerve pain, they may feel a little bit more at night, because during the day we have lots of different distractions. We're doing something, we're cleaning the house, we're working, things that kind of take our mind off of pain. But at nighttime, we don't really have those things. We're trying to relax. And so sometimes all that kind of catches up to you and you kind of feel it a little bit more.
And what about a time when people are working? That's another thing. Perhaps that's more of a lifestyle, and you're choosing what kind of work or what kind of activities. Do you have any specific recommendations in terms of what I need to avoid or what I should be doing while at work, perhaps?
So I think that biomechanics is really the most important thing. I think the tough part about having a job, either a job that is with a lot of lifting, or a job even at a desk, is that oftentimes we don't really think about the body mechanics. We think, I need to get this done. How can I do it? And so we twist, we move, we just do something to kind of get the job done. But what's important is to have good ergonomics, when you're sitting at a desk, to have good lifting techniques when you're actually lifting things, and actually pay attention to those things and not move your body in directions that it shouldn't move. And so that's what I would say in terms of the workplace, is that we got to make sure that we're doing things with proper lifting techniques and proper ergonomics when we're sitting at a desk.
What about stress? That's an interesting question here. We have from a very nice viewer. How does stress, and this kind of gets back to Dr. Andrew O's talk last week too, the wellness, how does stress affect my low back pain?
So stress, it's all about tension, right? So when you're stressed, you actually have a lot of muscle tension, and the muscles themselves can restrict the joints from moving. The muscles themselves can actually be painful. And there is a big interplay between the emotions that someone has, whether it's stress, whether it's depression, whether it's happiness, and their actual sensation of pain. And so all those things are kind of related. So stress definitely has a big role.
How about when I should come see you, Dr. Vu? If I tried to decrease my stress, I've gone to the acupuncturist, chiropractor, I've had massage therapy. When do I need to call a specialist, interventional pain specialist, such as you, Dr. Vu?
I think that when you kind of seen and done all the kind of basic stuff, when you try to do some physical therapy, maybe take some over-the-counter analgesics, and you just find that this is just not going away, and that's really impacting your function. That's when you should probably do something sooner rather than later. Because in my talk, we talked a little bit about the snowball effect, right? Now, the longer that something goes on, the more difficult it is for it to get better on its own, and the more likely that other things are going to start breaking down. So I think it's important to try the conservative management and try the other stuff that you can do, because most of the time the pain will get better. But if you find it's impacting your function and it's really not getting much better, that's when you should start seeing us before things actually get a lot worse.
And what about surgery? What kind of surgeries do you, Dr. Vu, recommend and perform?
I think I'm having some connection issues.
Uh-oh, may have lost
Yeah.
Dr. Vu for a bit there. Dr. O, you want to take over for a bit until we get Dr. Vu back here?
Yeah, we don't really perform major surgery at our clinic. We do perform some minor and minimally invasive procedures that you could potentially categorize as surgery. We have multiple different types of surgical options. We use a specialized spacer in the back that helps with spinal stenosis. We use spinal cord stimulation, which is electrical stimulation of the nerves of the spinal cord to help alleviate pain. We do a minor procedure called radiofrequency ablation, which help burns the nerves to the facet joints. We do refer out to surgeons, and sometimes that's necessary.
For the radiofrequency lesioning procedure, that's a common procedure we see quite a bit for low back pain. Do you lose a lot of functioning after burning those nerves? What are you burning? Because I thought burning nerves, a lot of patients will say, I thought burning nerves were a bad thing, Dr. O.
No, not a bad thing necessarily. We're targeting a very small nerve. It's called the medial branch nerve, and that specifically goes to the facet joint, and it also innervates the multifidus muscle. Most of the studies show that you don't really lose much function when you deaden this nerve using radiofrequency ablation. And it's not a permanent ablation, so that nerve does re-innervate, and you get function of that nerve back. So you do often have to repeat that procedure.
And what about narcotics or opioids? What kind of role do you feel narcotics play with low back pain treatment?
I think most pain management doctors now can agree that long-term opioid therapy really isn't the first-line treatment for most patients, especially when it comes to back pain. It really hasn't been shown to be an effective long-term therapy. So in most cases, it's a last resort type of therapy, or it's a temporary. So if we can keep the use of it, to a couple weeks, to a few weeks, you're waiting for a procedure, you're waiting for a surgery. Those are the times when we can utilize opioid therapy.
Can you tell me what you would recommend at home I start with if I start having pain? What kind of pills, what kind of medications do you recommend that I take for my my low back pain that perhaps starts in the morning?
I think you really have to get evaluated before you start using medications. There are multiple reasons why you can have back pain. If it's something that's not getting better with some stretching, heat, ice, rest, you should probably see your primary care doctor, possibly get a referral to physical therapy. And if those are not working, then you could get referred to a specialist. Most people will probably start with Tylenol and ibuprofen. But again, you really have to diagnose and treat the problem more than just take a medication.
I see. Um, how do I contact you? What's the best way? Do I have to go through my primary care doctor nowadays, or what do you recommend?
Most of the time, you can refer yourself through our website.
Mhm.
You can put in a um, your information, your insurance information, your demographic information, and then some insurances require you to have a referral from your primary care doctor. So you would have to call and contact your primary care doctor, and then they will make a referral to us.
You don't, do you prefer one or the other, or do both work? The primary care doctor referral or just referring self-referrals?
Either way, it just depends on the insurance mainly.
Mhm.
Can you
And
give me
how
just
about,
one second here?
sure. I think Dr. Vu is perhaps performing changing ergonomics a little bit. We lost him for a little bit. He's making some lifestyle modification, but I would say this low back pain talk has been very informative. If you do seek more information, there are videos of Dr. Vu talking further about some of the procedures that he had mentioned on his talk, particularly the radiofrequency lesioning, the medial branch block. I believe Dr. O has an excellent talk about the spinal cord stimulator, the sacroiliac joint injection. There's also videos of our other doctors at our clinic named Dr. Cho. Dr. Youngin Cho has a video about what types of interventional pain management treatments she offers for low back pain. And it's all at paincareoregon.com. One more question, Dr. O, is people are concerned about the back pain causing some permanent disability. There are also concerns about just when do I have to go to the ER? What would you say about that?
Again, I think it really needs to come down to seeing a provider, being evaluated, get examined, and let someone who has some experience with that help you with that. If you're having true weakness and numbness, and you're not able to move your leg, or you're not able to feel your foot, or you're losing control of your bowel or bladder, that's definitely a time you want to go to the ER immediately.
Mm-hmm.
I would
Okay.
say in terms of work, disability is it's a difficult topic. It's hard to say when someone is disabled and when they're able to go back to work or be retooled to do this different type of work.
Mm-hmm.
So again, it's a individual basis recommendation.
Is that what you find to be some of the more challenging things, is determining what limitations perhaps a person has from the low back pain?
No, I think when we evaluate the patient and we get physical therapy involved, we're able to find what someone is able to do, and most people are able to function with some treatment.
Very nice. Okay. Well, that was delightful. Next week, we'll have another topic. We'll have a presentation from another one of our docs at the Pain Care Specialists of Oregon. Thank you, Dr. Andrew O. And
Yeah.
thank you, viewers.
I would just like to add one more thing. We did talk about stress briefly, but there is a lot of data on mental health that is associated with low back pain. So if you're suffering from anxiety, depression, PTSD, you're definitely at a higher risk for suffering chronic low back pain. So dealing with those issues is just as important as dealing with the back pain. So again, at our clinic, we try to really evaluate and treat the person as a whole rather than just focusing on one simple thing.
Excellent point. And I think that was a big reason why I think you had started the NeuroFlow at the Pain Care Specialist of Oregon to help people, even at the comfort of their own home, which is so important now more than ever, to be able to treat mental health, anxiety, stress, like you mentioned, with that NeuroFlow that we're offering as of this February, just before these challenging times occurred. And
Absolutely.
that's an excellent point, Doctor. We'll have a talk on that perhaps in the future. And we also thank Dr. Cuong Vu, and he is, I'm sure, excited to talk further in the future. And thank you, Dr. O.
You're welcome. Thank you. Thanks for viewing our little live stream here. And
Yeah.
don't forget to look at our website, paincareoregon.com.
Thank you.
See some of you soon.
Yeah. Bye-bye.
Okay, bye.